Hey everyone, scrolling through the news lately. I know I have, and it's a bit scary. All these headlines about bird flu and Marburg virus, it's like we're all kind of holding our breath, waiting for the next pandemic. And that's why today we're diving deep into the new age of viruses. Are we ready for the next pandemic? We've got a whole bunch of news articles and scientific reports, and even a take from an astrologer to try and unpack all of this.
It's so interesting you mentioned that feeling of dread because it does feel like everyone is so aware of infectious diseases now, like way more than we ever have been before.
Right, it's like COVID was this wake-up call, and now we're all just a bit jumpy. So let's start by getting a sense of what's got everyone so spooked. As of right now, December 2024, the viruses making headlines are avian influenza, that's H5N1, the Marburg virus, Mpox, new COVID-19 variants, and even a surge in norovirus cases.
And it's important to remember that all of these have different levels of risk. Norovirus, for example, is highly contagious, but it usually just leads to a short illness. And then you have something like Marburg, which is scary because it has a high fatality rate, but it's thankfully harder to transmit.
Okay, so different viruses, different concerns. But the one that seems to be really grabbing people's attention right now is avian influenza, or H5N1. We've got this news article here detailing a pretty concerning case in Louisiana.
Right, and this was the first severe case of H5N1 in the US, which is alarming on its own. But what's especially worrisome is that the virus in this particular patient showed mutations that make it better at attaching to human cells.
Oh, wow. And what does that mean practically speaking? Like, is it easier to catch now?
Potentially, yeah. Before, transmission was mainly through direct contact with infected birds. But with these mutations, there's a chance it could spread more easily through the air, like through coughing or sneezing.
So, like COVID. And if it does become more like COVID in terms of transmission, that's a pretty terrifying thought, especially given that H5N1 has a 60% mortality rate.
It's definitely a cause for concern, yes. And it's why health officials are monitoring this situation really closely and stockpiling vaccines. However, we haven't seen any sustained outbreaks in humans yet, so that's a good sign.
Okay, that is a little bit of good news. But, for those of us who might not remember, can you remind us what exactly is avian influenza?
Sure. Avian influenza, or bird flu, is a type of influenza, a virus that's usually found in wild aquatic birds. These birds can carry the virus without showing any symptoms, but it can be deadly for domestic poultry like chickens and turkeys.
And how does it jump from birds to humans? Like, is this something we should be worried about in our daily lives?
Usually it's through direct contact with infected birds or their droppings. So poultry workers and people living near poultry farms are definitely at higher risk. That's why those groups need to be extra careful and take safety precautions.
So for the average person, like me, who's not hanging out on poultry farms, the risk is still pretty low.
Exactly. But it's still good to know the symptoms. Early on, it can feel like a typical flu, so fever, cough, sore throat. But in severe cases, it can progress to pneumonia and organ failure really quickly.
Okay, noted. Avoid sick birds, wash my hands, and be on the lookout for those symptoms. But it's not just H5N1 that people are worried about right now. This article we have here called What Most People Fear Now About the Viruses really dives into the anxieties surrounding all of these different outbreaks.
What I find so interesting is how people's fears seem to be connected to the specific characteristics of each virus. So with H5N1, it's that potential for a really bad pandemic, like with a high fatality rate. It brings back memories of COVID, but potentially much deadlier.
Right, COVID is definitely still fresh in everyone's minds.
What about the other viruses? What's causing all the fear there? Well, with Marburg virus, it's the extremely high fatality rate, up to 88%. And the fact that we don't have any specific treatments or vaccines for it, it's a hemorrhagic fever. So it makes people think of Ebola, which was obviously terrifying for a lot of people.
Right, hemorrhagic fevers are definitely scary. Okay, what about norovirus? That one seems to be popping up everywhere.
Yeah, with norovirus, it's more about the inconvenience and disruption it causes. It's incredibly contagious and leads to these really rapid outbreaks. I think people are afraid of things shutting down again, like schools and workplaces.
So it's less about the severity of the illness and more about the fear of everything grinding to a halt again.
Exactly. And then we have Mpox. While cases have declined since that outbreak in 2022, there's this new, more severe strain that's causing concern. It has a higher mortality rate, which is really worrying, especially in regions where healthcare systems are already struggling.
And of course, we can't forget about COVID-19. New variants are still emerging, and there's always that worry that one of them might evade our current vaccines and cause another wave of infection.
It's understandable, right? The pandemic had such a profound impact on everyone, and the thought of going through that again, possibly with an even more dangerous variant, is a very real fear for many people.
So we've got all these viruses circulating, and everyone is understandably on edge. But the big question is, are we actually any better prepared for a potential pandemic now than we were a few years ago? Like, did we learn anything from COVID, or are we just as vulnerable as we were before?
That's the million-dollar question, right? And I think the answer is, like with most things in life, it's complicated. There has been progress, for sure. But there's still some big challenges we need to overcome.
Okay, so let's break that down a bit. What are some of the areas where we've actually seen some improvement?
One of the most significant areas of progress has been in vaccine technology. The development of mRNA vaccines during the COVID-19 pandemic was a total game changer. We were able to develop and deploy those vaccines at a speed that was unheard of before.
Yeah, I remember that. It felt like science fiction becoming reality.
Exactly. And that same mRNA technology is now being used to develop vaccines for other viruses, including H5N1. Having that platform already in place means we can potentially respond much faster if a new threat emerges.
That's a huge advantage.
Oh.
What about our ability to detect and track these viruses before they get out of control? Have we improved our surveillance systems at all?
Yeah, absolutely. Global surveillance systems have come a long way. We're seeing much more real-time data sharing between countries now, which is so important. And genomic sequencing is helping us track viral mutations much more quickly. Early warning systems are also being constantly refined and improved.
So we're getting better at spotting those red flags early on, which gives us more time to react.
Exactly. And on a global level, there's a much greater understanding now of the importance of international cooperation and coordination. The pandemic made it so clear how interconnected we all are, and how a health crisis in one part of the world can quickly become everyone's problem.
Right. It's not just about protecting ourselves, it's about protecting humanity as a whole.
Exactly. We're seeing a lot more collaboration on research now, resource sharing, and the development of global health strategies. Organizations like the World Health Organization are playing a much more prominent role in coordinating these responses and setting standards. But, and it's a big but, there are still some major obstacles that we need to address.
Okay, so let's talk about those obstacles. What are some of the biggest challenges that are still preventing us from being truly prepared for a pandemic?
Health inequity is a huge one. Access to healthcare, vaccines, even just basic sanitation remains vastly unequal around the world. And as long as these disparities exist, we're going to continue to see outbreaks that disproportionately impact vulnerable communities. And these outbreaks then have the potential to spread quickly to other parts of the world.
It's like trying to build a dam with big holes in it. It doesn't matter how strong some parts are if the whole structure is weak.
Exactly. That's a great analogy. And then we have the issue of misinformation. The pandemic showed us just how rapidly false and misleading information can spread online. And this can really erode public trust in science and undermine all the efforts to contain these outbreaks.
Yeah, social media can be a breeding ground for conspiracy theories and just bad information.
It really can, and that's why building trust and communicating clearly and effectively is so crucial. We need reliable sources of information and clear strategies for combating misinformation proactively.
It feels like a never-ending battle, but it's one we can't afford to lose. It's not all doom and gloom, though, right? There are things that we can all do as individuals to protect ourselves and our communities.
Absolutely. Personal responsibility plays a huge role in all of this. Getting vaccinated, practicing good hygiene, staying home when you're sick, these are all simple but effective things that everyone can do.
And just staying informed, right? Like being critical of the information that we come across and making sure we're getting our information from credible sources.
Yes, that's so important these days.
Okay, so we talked earlier about the astrologer, Osher. His take on all of this is a little different. He's looking at things from an astrological perspective, and he's identified some influences that he thinks could affect global health trends in 2025.
Yeah, it's definitely an interesting perspective.
I'm a little skeptical, I have to admit, but I am curious. So what does astrology have to say about all of this?
Well, he highlights a couple of key astrological alignments in 2025. For example, there's Mars retrograde in Cancer from January to February. And he believes that this could create some vulnerabilities, particularly in the digestive system.
So like a surge in stomach bugs, should we all stock up on Pepto-Bismol?
It's not necessarily that literal. It's more about recognizing that our relationship with food and our gut health in general might be more prominent themes during that time. It could manifest in things like foodborne illnesses or disruptions in food systems, or even just a heightened awareness of gut health and how it affects our overall well-being.
You're listening to Echoes of Insight, where we dive deep into the topics shaping our world, from the planet and politics to health, consciousness, economy, and alternative lifestyles. If you're enjoying the journey, make sure to subscribe and share this podcast with others who love exploring new perspectives.
Interesting. So it's not just about physical health, but also how our mental and emotional states tie into all of this.
Right. And then there's Pluto in Aquarius and Jupiter in Gemini. Asher believes these placements could highlight air-related concerns.
Air-related. So does that mean more respiratory illnesses? It's kind of fitting given that we're talking about avian influenza.
Exactly. He sees this as a potential indicator of challenges related to air quality, respiratory health, and the spread of airborne diseases in general.
Wow. So it's like we're all connected not just through physical contact, but through the air we breathe.
It really is all connected. And Asher also points to the winter of 2025 as a potential time of major transformation, especially when it comes to health, hygiene, and our collective consciousness.
Okay, that's pretty intriguing. What kind of transformation are we talking about here?
He talks about a series of astrological shifts that could create this sort of upheaval. It starts with Mars retrograde in Cancer, which we just talked about, but there's also Venus retrograde in Aries happening in March of 2025. Venus is all about relationships and values, and its retrograde in Aries could create some tension, like maybe between personal desires and the need for security. This could even lead to conflicts related to things like health choices and individual freedoms.
Oh, wow. So like debates about mask mandates or vaccine hesitancy, we've definitely seen how heated those can get.
Exactly. And then we have the eclipses on the Virgo-Pisces axis, happening also in March of 2025. Virgo is all about health and routines, while Pisces is associated with things like surrender, spirituality, and collective healing. Asher believes these eclipses could signify a breaking down of old structures and a need to embrace new, more holistic approaches to health and well-being.
It's like a time of a lot of change and possibly even some chaos, but maybe also a time to rethink how we define health and what it really means to thrive.
Exactly. It's a time of great potential.
Okay, so we've talked a lot about astrology and the more kind of spiritual aspects of this, but we haven't really touched on zoonotic spillover, which is a big part of why we're seeing all of these emerging diseases. We have this article here called From Animals to Humans that really gets into this.
Right. Zoonotic diseases, these are the diseases that jump from animals to humans, and it's definitely a growing concern.
It seems like they're on the rise, like we're hearing about them more and more.
Yes, they are. And this article really dives into the factors that are driving this trend. Things like habitat destruction, climate change, the wildlife trade, and intensive farming practices. Essentially, it's all about how human activities are disrupting ecosystems and creating more opportunities for viruses to cross over from animals to humans.
So in a way, we're creating the conditions for these outbreaks by interfering with nature.
You could definitely say that. And what's interesting about this article is that it goes beyond just the scientific perspective. It also explores some of the spiritual and energetic imbalances that might be contributing to this.
Okay, spiritual and energetic imbalances. That's a new one for me. What does that even mean?
Well, it draws on some shamanic traditions that view disease as a reflection of disharmony between humans and the natural world. It's about recognizing that we're all interconnected. And when we disrupt that balance through actions like deforestation or the exploitation of animals, there can be consequences. And those consequences can include things like new diseases emerging.
Wow, so it's like a cosmic check and balance system. We push too far in one direction and nature pushes back.
Exactly. And the article suggests that these outbreaks that we've seen, like Ebola and COVID-19, can be seen as wake-up calls. They're urging us to reevaluate our relationship with the planet and find ways to live in greater harmony with nature.
That's a pretty powerful thought. So it's not just about science and medicine. It's about our values, our consciousness, our connection to the natural world.
It really is about all of those things.
This whole conversation is really making me think differently about all of this. It's not just about viruses. It's about our entire approach to life and how we fit into this bigger ecosystem.
I'm glad to hear that.
But I am curious. We've talked a lot about the big picture, but what about the specific diseases that are emerging right now? And how are they impacting different parts of the world?
Yeah, that's a good point. Let's zoom in a bit and look at what's happening on the ground right now. We have another article here that provides a really good overview of the diseases that are causing the most concern globally.
Perfect. Let's dive into that.
What?
Okay, so this article is titled Global Health Concerns, a deep dive into disease outbreaks and increased illness risks in 2024. What's the current situation?
Well, this article gives us a pretty comprehensive overview of the health challenges we're up against globally. As we've already touched on, respiratory illnesses are a big concern right now, with avian influenza being the most prominent one. But we're also seeing a resurgence of other respiratory viruses like RSV and, of course, new COVID variants.
Ugh, feels like COVID just won't go away.
Yeah, it does, doesn't it? But the good news is we do have vaccines and treatments now that can really help reduce the severity of illness. The challenge now is making sure everyone has access to those resources and staying ahead of the virus as it mutates.
Yeah, like a constant arms race.
Uh-huh.
Okay, but what about threats that aren't respiratory? The article mentioned some gastrointestinal issues like norovirus and cholera.
Norovirus is definitely making its rounds right now. It's super contagious and causes those classic symptoms of vomiting and diarrhea. Actually, the CDC is reporting the highest number of norovirus outbreaks in the U.S. since 2012.
Oh, wow, that's not great. Is there anything we can do to protect ourselves from that?
Thankfully, most people recover from norovirus within a few days. But it's really important to be extra careful about hygiene, especially washing hands thoroughly and frequently. Disinfecting surfaces regularly can help too.
So just basic hygiene, got it. Okay, what about cholera? That one always sounds pretty serious.
Cholera is a bacterial infection that can cause severe diarrhea and dehydration. It's usually linked to contaminated water and poor sanitation, so it's more common in developing countries. But we do also see outbreaks after natural disasters or in refugee camps, places where sanitation systems are compromised.
Right, so more of a localized threat, but still something to be aware of. Okay, the article also mentioned some zoonotic diseases that sound particularly scary, like Marburg virus and dengue fever.
Yes, those are both very serious concerns. Marburg virus is a hemorrhagic fever similar to Ebola, and it has a very high fatality rate. There are outbreaks happening right now in Africa, and it's definitely on the radar of global health organizations.
I remember those images from the Ebola outbreak a few years ago. Hopefully they can contain Marburg before it spreads further.
I hope so too. And it really highlights how important it is to have strong surveillance systems in place so we can respond quickly to these new outbreaks. And then there's dengue fever, a mosquito-borne illness that's becoming more widespread, largely due to climate change.
Ugh, mosquitoes. And climate change is only making things worse, right?
It is, unfortunately. As temperatures rise and weather patterns shift, disease-carrying insects, like mosquitoes, are able to spread to new areas. So these types of illnesses are likely to become more common in the future.
So it's not just viruses we need to worry about. It's bacteria, parasites, even fungi. I remember this article mentioned a fungal infection called Candida auris that sounded pretty nasty.
Yes, Candida auris is becoming a growing problem. It's a type of yeast that's resistant to many antifungal medications, so it's really difficult to treat. It can cause some very serious infections, especially in people with weakened immune systems. And it's been found in healthcare settings all over the world.
Wow, it's like we're surrounded by all these tiny threats. Okay, but what about the illnesses that are less understood? The ones that don't really fit neatly into a category. The article touched on that briefly.
That's a really important point. There are a lot of people out there suffering from chronic conditions that haven't been properly diagnosed or for which there's no clear medical explanation. Things like chronic fatigue syndrome, fibromyalgia, and some gastrointestinal disorders are good examples.
Right, it's like those conditions that often get dismissed as being all in your head because doctors can't find a specific cause.
Exactly. And it can be so frustrating and isolating for people who are experiencing these symptoms but don't have any answers or effective treatment options. It really underscores the need for more research into these complex conditions and a more holistic approach to healthcare that takes the whole person into account.
I agree. It's not just about treating the physical symptoms. It's about addressing the whole person. Well, this has been quite a deep dive. We've covered so much ground today. But if you had to sum it all up, what would you say are the most important things for people to remember?
I think the biggest takeaway is that the threat of new and emerging diseases is very real, and it's a threat that's constantly evolving. We live in a world where viruses can spread incredibly quickly, and our actions, from how we treat the environment to how we address global health inequities, are directly impacting the emergence of these diseases.
So it's not just bad luck, it's about the choices we're making.
Exactly. We have a responsibility to act both individually and collectively. On a personal level, we can prioritize our own health, practice good hygiene, stay informed, and make choices that support a healthier planet.
Things like eating a balanced diet, getting enough sleep, managing stress, reducing our environmental impact. It all adds up.
It does. And collectively, we need to advocate for better public health systems, support scientific research, and work towards a more sustainable and equitable world for everyone.
It sounds like a huge undertaking, but it's empowering to know that we're not powerless. We can make a difference.
We absolutely can. And it's important to remember that this isn't about living in fear. It's about being aware, being prepared, and taking action. It's about using what we know to create a healthier and more resilient future for ourselves and for generations to come.
I love that. Well, we've explored this new age of viruses, the fears they create, and all of the complex factors driving their emergence. We've also talked about the progress we've made, the challenges we still face, and how we can all contribute to a healthier future. It's been a lot to take in, but I hope you found it as informative and thought-provoking as I have.
It's been a pleasure. Stay curious, stay informed, and stay well, everyone.
Thanks for tuning in to this episode of Echoes of Insight. If you enjoyed this deep dive, don't forget to hit that subscribe button and share it with someone who loves exploring big ideas. Together, let's keep the conversation going. See you next time.